So the PIONeeR study, I thought was just very exciting because it's a public-private partnership, and it's a group from Gustav Russi working with a number of collaborators both in academia and industry, trying to get biomarker results on patients getting immune checkpoint inhibitors, both pre-therapy and then on therapy, and then dividing the group up by those who have durable response, have no response, or everything in between, different numbers of weeks of response. And while the trial really was more of a description of the massive number of tests they're doing, over 100, maybe even more, it tells you that they're cataloging responders versus non-responders, and trying to understand the biology of who responds and not, so that we can have predictive markers. And I was impressed because they did show PD-L1 density, a little bit of a more detailed PD-L1 analysis. Did predict a bit better than some of the other markers. We haven't seen any of their prospective studies yet. They haven't started, but the next part is to then use these markers in clinical trials. Still very early, but it makes us sort of take pause. There were so many Me Too trials at ESMO. There were so many Me Too trials at ASCO. How many more PD-1, PD-L1 inhibitors do we need? If patients aren't responding to those, they've got mechanisms of resistance. In targeted therapy, we wouldn't just do combinations. We would understand why those patients are resistant. So I thought the fact that PIONeeR was getting tissue to understand that speaks to what we need to do worldwide. And I also, at the end of my talk, mentioned the lung map trial, the lung master protocol, which we're running in the United States, also a public-private partnership, where industry and academia and the Friends of Cancer Research and the NCI cooperative groups are getting together. And we have 700 sites now where everyone gets a Foundation Medicine profile on their tumor, and then they're assigned to different arms of the trial based on those results. So that's the future, and I was very happy to see that presented in an oral session at ESMO.